Well, good afternoon, everyone. Thank you so much for joining us at WECA to discuss the Wisconsin Infant Toddler Policy Project. We're going to provide an overview today, but we are hoping that this is the first of many conversations that we'll be having over the next year to 3 years about this project, our policy and budget campaign and advocacy efforts. Just to introduce myself, I'm Kimber Lytle, the Business Engagement Director for WECA, the Wisconsin Early Childhood Association. I'm fairly new to WECA. I've been here just a few months as a part of the Wisconsin Infant Toddler Policy Project. I'm bringing with me a bunch of government experience prior to my time at WECA. I've worked in the Wisconsin State Legislature for the Senate Majority Leader, Scott Fitzgerald. I was the policy director for Governor Walker, and I'd worked at the Wisconsin Department of Children and Families as the legislative liaison. So all of that background has been helpful as we are working at WECA on the Wisconsin Infant Toddler Policy Project, putting together a policy and budget campaign, our advocacy and outreach efforts, et cetera, which we'll go into during the course of this presentation. With my new role at WECA, I have been working on this project, putting together our policy and budget campaign, engaging new stakeholders to be a part of our discussion with our early childhood education advocacy efforts, with hopes that they will be new partners for us going into the next legislative session that starts in January of 2021 to help add their voices to all of ours as we work to advance early childhood education initiatives for the Wisconsin state budget and other pieces of legislation. With me today is Ruth Schmidt. Ruth, would you do an introduction, please?
Good afternoon, everybody. As Kimber said, I'm Ruth Schmidt. I'm the Executive Director here at Wisconsin Early Childhood Association. I've been here for about 18 years. Thrilled to be with you this afternoon, and very much looking forward to the conversation as we go through the agenda. Thank you.
So over the course of our presentation, we'll give you an overview of the Wisconsin Infant Toddler Policy Project. It's a 3-year project that is funded by the Pritzker Children's Initiative. Then we'll go into the policy and budget campaign component of it, the advocacy and outreach, and then we'll have questions at the end that if you could put them in the chat box, that will be great. And then Jen and our staff will be monitoring those and we'll address all of your questions at the end. Just a reminder, if you would like to get credit from the registry for attending this presentation, please just make sure in the chat box to enter your name and your registry number, and we'll probably do a reminder later on about that too. Thanks so much.
Great, thanks, Kimber. Again, just as we're going through the presentation, we're not going to stop midstream right now to be taking questions, so please put them in the chat box. We will be monitoring those and we will try as much as possible to address questions when we wrap up the formal part of the presentation. So as Kimber indicated, we're here to talk a little bit about the Wisconsin Infant Toddler Policy Project. This is work that began in 2019 and, as Kimber said, was funded through a grant from the Pritzker Children's Initiative, and we continue to receive ongoing funding to actually help us take our policy agenda and our budget agendas and put effort behind them to ensure that we move forward in the state of Wisconsin to achieving better outcomes for infants and toddlers that are in early care and education settings in our state. As part of the Infant Toddler Policy Project, we had some key deliverables that you see in front of you. The first deliverable required of us was to establish a collaborative that represents the diversity of Wisconsin. And we came at this from wanting to include both inside and outside government partners. So we had state and community-based governments, we had nonprofit organizations, advocacy organizations, philanthropies, likely and unlikely allies, and you'll get a sense of that as we move through the agenda, and others that are committed to achieving the goals and outcomes of this project. The second deliverable was to create a detailed policy agenda designed to expand high-quality services for low-income infants and toddlers and their families. There is a pretty significant goal of impacting 25% more infants and toddlers in terms of getting them into high quality early learning situations and providing supports for optimal development and well-being of infants and toddlers. And so as we go through the agenda, you'll see things that are connected to both looking at optimal health and well-being outcomes, along with looking at outcomes to expand capacity of high quality, affordable childcare options for families under 200% of poverty. And then the third piece that we had to do was to develop a strategic action plan that describes how the state collaborative would advance those policies. We will not be getting into that in detail today. We really will be focusing on the second of these deliverables with you. So I wanted to put out here who the partners have been that have been working with us over the course literally of all of 2019. I'm not going to read all of these to you, but I do want you to take a minute, and there's 2 slides of them, so in a second I'll advance to the next slide. But I really wanted to put this up here as a way for you to see clearly that this was an effort of bringing together some early care and education organizations such as Kids Forward, Supporting Families Together, Association, the Wisconsin Alliance for Infant Mental Health. And so you'll see some of those partners engaged in this work with us, but you'll also see very different partners that have been at the table with us, such as Rural Wisconsin Health Cooperative, the Northwest Wisconsin Workforce Investment Board, the League of Wisconsin Municipalities, and others. So I'm going to go to the next slide so you just get sort of the full context of who's been at the table with us. So we had United Way partners. We have had the Wisconsin chapter of the American Academy of Pediatrics, community action organizations, the Towns Association. So a really broad table was sort of set to bring people from a multi-sector perspective into doing this work with us. We really wanted to expand those allies and advocates who are willing to take parts of our agenda and include it in part of what they themselves will be advocating on over the coming 2 or 3 years in terms of advancing this work. Along with all of the partners that we talked about, this was developed in key collaboration with the Department of Children and Families, the Department of Public Instruction, the Department of Workforce Development, the Office of Governor Evers, and the Wisconsin Legislative Children's Caucus. Again, we really are looking at the only way to be successful in advancing a bold policy and budget change for infants and toddlers is by having strategies both inside government and outside government. One of the first things that we did in terms of advancing this work and determining what our policy agenda was going to be was surveying parents across the state of Wisconsin. I want to clarify, this was not necessarily a scientific survey. This was a survey that was released and sent out by all of the partners that have been around the table with us. You can see in terms of who the demographics were that responded to their survey. We had close to 3,000 individual parents respond to this survey. And this was the first piece that sort of helped to inform what our policy agenda was going to be. I'm not going to go through all the questions that we asked, but I have picked out a few that I think for those of you, most of you in early care and education, these will come as no surprise to you when you see the sorts of concerns that we were hearing from parents. So in terms of the top 3 community needs that parents identified with respect to childcare for infants and toddlers, not surprisingly, 75% of respondents said making existing childcare more affordable for families. You can see the other 2 are talking about improving the quality of care and making care scheduling more flexible for working families. Additionally, we asked a question about, do parents have an easy time finding care for infants and toddlers that meets their needs? 74% of parent respondents either strongly disagreed or disagreed with that statement. 79% of respondents agreed with the statement that center-based childcare options for infants and toddlers cost too much in my community. Again, this is not a surprising finding. We also asked that question about family childcare for those of you who are family childcare programs that might be on with us today. And I believe it was between 55 and 60% of parents responded that they felt that family childcare was also too expensive of an option for infants and toddlers in their community. The next couple of things that I'm going to go through will have sort of a chart that you'll see when I go to the next screen. The question was, select from the following list your top 3 community needs with respect to childcare for infants and toddlers. They're a little squished in terms of what the words are on the whole thing, so please pay attention, especially to item D here, which is making existing childcare more affordable for families. So when we go to the next slide, you will see in the middle there, in that sort of teal colored box, 75% indicated that that was the top priority, was making existing childcare more affordable. Also, you will see having more center-based childcare options and improving the quality of care. The next question that I found the response to this really sort of interesting and a little bit disheartening, I have to say, in terms of early care and education. We posed the question about when you have had, or when you have or had questions about your children when they were young, who did you turn to for advice? So family and friends, doctors, pediatricians, child care programs, straight through to the website or social media. And you'll see here, family and friends and turning to your doctor or pediatrician scored really high. And I don't necessarily think that's surprising. However, I do think that when we realize that families are turning more to websites and social media for information about their young children instead of their child care provider, I think to me that's a concerning finding here. And knowing the landscape of who works in early care and education in Wisconsin, we have an incredible group of women that have a lot of skills and knowledge about child development. And so I would love to see this change over time. I think that would be a really good thing for us. So pre-COVID, because this work started before the pandemic hit, these were just sort of some of the industry trends that we saw in Wisconsin. So over half of Wisconsin's residents lived in childcare deserts. In rural Wisconsin, that number pushed closer to 80% of residents living in childcare deserts. And you can only imagine how that has gotten worse in the midst of COVID. We also know that a super high percent of kids under the age of 4 in Wisconsin are in care at 75%. We know that over half of our workforce has at least an associate's degree. However, they're earning very low wages at approximately $10 an hour on average. We do know that of our early childhood workforce, a high percent of them are receiving one form of public assistance themselves. We would love to see us get to the point where wages are adequate enough that people who come into this work can make a living at it. We were already pushing a 40% turnover rate for people working in early care and education. So for our child care teachers, again, really not good for the development of young children. And then prior to COVID, we had already seen this trend where we had lost about 70% of our family child care in Wisconsin over the last decade. And we had also lost about 9% of our group programs. And we'll talk a little bit later about what that number is looking like now in light of COVID. So along with surveying parents, along with looking at what the landscape was and doing focus groups for community engagement, there were focus groups that happened across Wisconsin to engage community leaders in terms of hearing what their concerns were. The team that was part of the Infant Toddler Policy Project, our state collaborative team, came up with this vision statement as to what the vision of our project would be. And that is that every low-income family with an infant or toddler would have access to high-quality, affordable, culturally and linguistically responsive early care and education that meets their family and employment needs and supports optimal child development and well-being, and that the early childhood workforce will have the skills, training, and support to deliver high quality care and education with commensurate compensation. We have 3 primary goal areas within this project. And I believe, in case people are curious, I believe we can send out this slide deck to anybody who registered following the presentation today, so that you don't have to write all of this down because there's a lot of information. So the first area that we focused on for goals was really looking at this area of ensuring that we're promoting optimal early childhood development and well-being. And so when we talk about this goal, we're looking at systems that are touching the lives of children. So it's parents, it can be your early care and education providers, it can be home visiting, it can be infant mental health consultants. We really went broad in terms of where we see kids impacted in terms of promoting early childhood development and well-being. So the 3 sort of subcomponents of this are developing a statewide system that gives people who touch the lives of infants and very young children access to high quality infant and early childhood mental health consultation to promote optimal social and emotional development. And so this is pretty much straightforward. What we're looking is advancing a statewide system of infant and early childhood mental health consultation that would be available to professionals that are touching the lives of infants and toddlers. We also looked at wanting to expand existing evidence-based programs that ensure parents have the supports that they need themselves to promote optimal health and development. And so within this framework, we were looking at a few subcomponents. One is wanting to expand Reach Out and Read Wisconsin, which is done in partnership with pediatric offices and is really geared at getting, at working on literacy development in young children, getting books into the hands of families that have young children, and then being able to use that also as sort of a diagnostic process when young children are in with their pediatricians and interacting with their parents, and pediatricians can observe what's happening and use that to support the care that they're providing. We also then had expanding healthy eating and access to nutrition supports as part of that. And then finally in this area, developing a statewide system of information and referral for families and family supporting programs. And so within this context, we're looking, and I want to also give a shout out that quite a bit of what we are doing in the Infant Toddler Policy Project is also closely aligned with what the state of Wisconsin is doing within their preschool development grant that is happening right now. And hopefully most of you are familiar with the preschool development grant Birth to 5 initiative that the state is also doing. And so in here, we had expanding support to implement a statewide rollout of a texting program for parents to help them with their infant toddler development and learn about necessary resources that would be available to them. And then to increase connections among and build on existing networks that provide information and referral. And so within this, we're talking about improving coordinated efforts of information and referral that could be coming from systems like your Child Care Resource and Referral Network, along with United Way and the 211 resource system that's out there in Wisconsin. The second goal area that we're looking at is ensuring that every low-income family with an infant or toddler would have equitable access to a range of affordable, high-quality care options that meet their needs. There's a couple subcomponents of this. The first is ensuring low-income families have access to high-quality, affordable childcare. And so in order to do this, we have several pieces around how we provide subsidy supports to income eligible families. So we want to strengthen Wisconsin shares by ensuring that currently eligible low-income families can access shares easily. It's not the easiest system to apply for and be determined eligible for. We want to eliminate parent copays, and we want to expand eligibility for Wisconsin shares up to 200% of the federal poverty level. Right now, Wisconsin shares for eligibility tops at 185%. So this would be giving us an additional 15% eligibility for that. And then looking at developing and implementing a refundable tax credit package that would be available for families with young children. Next, we want to ensure that childcare businesses and providers have the supports that they need to provide culturally, linguistically responsive, high quality, affordable childcare to low-income families. And so within this area, we're looking at providing supports to help family childcare providers enter into a regulated system. So we know in Wisconsin that we've seen growth of unregulated childcare programs, which is not to pass judgment on whether that is good or bad or indifferent. But we do want to see more of those programs go into the regulatory system. So we wanted to have incentives to help bring unregulated family child care programs into regulatory compliance. Additionally, we want to research and implement ways to more accurately finance high quality care using things like differential subsidy reimbursement rates, cost modeling, or contracting for care. So in this area, we're talking about, when we talk about cost modeling, what it's saying is, instead of simply looking at what market rate surveys show us about what you all are charging for the care that you are providing, doing cost modeling says, let's look more specifically at what the true cost of providing care for infants and toddlers is in Wisconsin. As you all know, Wisconsin shares, the average Wisconsin shares rate annually for an infant in Wisconsin is about $12,000. The true cost of providing care for an infant in Wisconsin, when we do cost modeling, actually pushes us close to looking at a $24,000 price tag. So in terms of being able to actually provide that level of support to infants and toddlers, childcare programs need to be able to sort of end the year in the black. And right now, that simply is not the reality when it comes to infant care. So we want to look at a way to increase the rate by using cost modeling. We want to see an increase in the use and access to early Head Start slots in the state of Wisconsin. We want to look at developing a financing model that would allow for contracting for care. So if you're a child care program, this could look like the state of Wisconsin entering into a contract with you to purchase a certain number of infant toddler slots in your program, or to purchase an entire classroom of infant care in your program, especially if you are located in one of these counties that is incredibly high incidence of being a child care desert, or incredibly high incidences of families living in deep poverty. The third goal area that we're looking at is really the workforce. And so the early childhood workforce, what we want is for all of them to have the skills and training they need to deliver high quality care. And we want to put a really strong caveat around that, which is receiving commensurate compensation. In this area, we have some subcomponents of this goal. And so one of those is developing and funding recruitment and retention activities, including a robust compensation strategy for the early childhood workforce. And so to do that, we have been looking at things such as offering signing bonuses to bring new qualified infant toddler teachers into the workforce, the potential of providing higher and more frequent wage supplements through a program like Reward for the infant toddler workforce, looking at the potential of developing a loan forgiveness program. This would be for teachers who have completed educational degree programs and spend a certain number of years working specifically with infants and toddlers. We're looking at the potential of increasing the TEACH model to include a way to cover childcare expenses for TEACH scholars so that they can have care for their own children covered while they're attending coursework. We're looking at wanting to make registry memberships free to childcare programs so that that isn't an additional financial burden that childcare programs have to shoulder. And then additionally, in part of this, we want to have this ability to increase compensation through things like increasing quality bonuses to 3-, 4-, and 5-star programs that would be indexed against compensation that would be provided for teachers. Incentivizing a diverse workforce. We all know when you look at Wisconsin's childcare workforce, it is probably about 98% women. We would love to see a diversification of that. We would also like to find a way to be able to better support women of color who are doing this work in the state of Wisconsin also. We have included in this goal area looking at developing an apprenticeship program, something like Grow Your Own or on-the-job training for high schoolers. So there's a richness of sort of subcomponents to these pieces that will become part and parcel of this agenda as we move through the next 3 years. And then in terms of professional development supports, we're looking at things like developing a network of infant toddler specialists, coaches, and mentors that can be working with early childhood programs, expanding the infant toddler pyramid model training that's available and ensuring supports for that. And then additionally, developing trainings and consultations around specific healthcare topics that we will be working on with, again, the Wisconsin chapter of the American Academy of Pediatrics. So I've talked pretty quickly and I've crammed a ton into sort of reviewing what are all the subcomponents of this. Anybody who really is interested in receiving a more comprehensive sort of review of the types of policies, we will, happily contact us following this, and we can connect you with ways that you can access some of those resources. So this is a really bold, transformative policy agenda. It was something that as we moved through last year and put this together, we were thinking about the price tag that would be on top of this, which obviously is astronomical in terms of really transforming what's happening in early care and education. And then of course, COVID hit, and you all are, most of you anyway, are sort of living the reality of the impact that COVID is having on early care and education. The other impact that COVID is having is that it is draining revenue sources from both our state and nation as our economy has sort of struggled to stay afloat. And obviously also the work that all of you are doing is critical to ensuring that we have a surviving economy and we have parents able to work. So that is sort of the complexity of going from 2019 with this robust policy agenda midway through 2020 when we're realizing that we have really limited resources. And so when we look at the impact that COVID-19 has sort of been having on the childcare industry, and as we talk through some of this, I believe Jen on our staff is going to be providing some resources that will be put into either a chat box or maybe the Q&A box for you all, where you can go in, you can see it, you can link to it, copy the link so that you have it for follow-up information as we're talking through this. And so right now in Wisconsin, our best estimate is that anywhere from between 25 to 30% of our pre-COVID-19 childcare slots are now in either temporarily or permanently closed programs. This translates to a loss of upwards of 50,000 regulated childcare slots. Wisconsin, prior to COVID, we had close to 185 to 200,000 childcare slots. Obviously, some of those are part-time, and so you've got multiple children taking a slot, but that was sort of what the landscape looked like. Right now, we know that between 25 and 30% of them are closed. The National Association for the Education of Young Children recently released a survey showing that without major federal relief coming specifically for childcare as part of a COVID relief package, we could see up to 80% of our childcare programs closed within the next 9 months. And I believe Jen is going to be putting that study in for you if you want to read more about that. That was based on surveys that they've been doing of childcare programs across the nation. And of course, for those programs that are still open and operating in Wisconsin, we know that most are reporting that they are operating at 50% of capacity or less. Which obviously, and those of you who work in the industry know you cannot maintain a child care program for long at all, probably not even weeks or months, when your enrollment is that low and we've burned through any federal relief that's available, and we're all kind of waiting to see what the next weeks and months are going to bring. So that sort of ends my part of this presentation, and now I am going to hand it over to Kimber to take us through the rest.
Thanks so much, Ruth. So next steps with the Infant Toddler Policy Project. So I'm going to go over our policy and budget campaign that we have put together based on all of that groundwork that's been done over the last year and a half. So we've put together a campaign plan for the next 2.5 years. So I'll give you a little bit of background on just the Wisconsin state budget process and just the legislative timeline as well. So technically the next session, 2021, starts January 2021 and ends in 2022. But that does not mean that the state budget hasn't started already, the next one. All of the agencies are required to submit their requests to Governor Evers by the middle of September, and then of this year. And then Governor Evers and his staff craft the next state budget throughout the fall and winter, and then it's presented to the new Wisconsin State Legislature in February of next year. So part of our campaign plan is putting together our budget asks that we work with the Department of Children and Families on, and then lobbying the governor's office and his administration going into this fall and winter. And then, like I said, the new legislative session starts in January. And let's see, the Wisconsin state budget usually it's due to be statutorily supposed to be completed at the end of June, but sometimes it may lag until sometimes even early fall. So we put together a robust campaign plan, like I said, going through the rest of this year into the 2021-2022 session. We've also hired 2 different lobbying firms, Hamilton and HWZ, to work with us in lobbying the administration and the Wisconsin State Legislature this fall going into the next 2 years. Also, as a part of our Infant Toddler Policy Project, we are polling. So we are contracting with a firm out of California called FM3. They do a Wisconsin Connections, and we will be polling likely voters this fall and then do a follow-up tracking poll 6 months later, sometime this winter. And that information will help to inform us as to the lay of the land, and as Ruth said, COVID's impact on our state, on accessibility and affordability of childcare, et cetera. And that will help to support our advocacy efforts going into next year. And then in regards to advocacy, just wanted to also talk about some of the outreach efforts that we have been doing. I had mentioned, I think, earlier on the outreach that we have been doing to employers around the state to help reiterate to legislators the core part that childcare provides to our state's economy. Again, it's hard for parents to work if there's no place for their young children to go. Also, a lot of parents, unfortunately, are realizing it's also difficult for K-12 systems to operate virtually or in a hybrid model if there is not someone to be home with their younger elementary school children. And WECA has heard from a lot of different communities around the state as they are dealing with these childcare shortfalls and childcare deserts, and as they're struggling to function, whether it's with the workforce or with K-12 schools. We've also been reaching out to different community leaders and providers as well. Again, it's so important for us to all be united as we move forward into the next legislative session to advocate for the same things and have the same message. Just again, my background having come from state government and being lobbied for so many years, it is so much more effective if everyone coming in has the same ask rather than competing or conflicting ones, to make sure that that ask or that budget request is added into the budget or a specific bill that you're lobbying on. So it just really helps to improve the likelihood that it will move forward. So as I had mentioned, right now, all of the state agencies are working on their various budget requests that will be submitted to Governor Evers. Ruth had already touched on a number of our various policy goals. Now, this is just kind of a fraction of our numerous requests and deliverables, but these are our main requests that we have been working on with the Department of Children and Families. They include a $30 million stabilization grant for child care providers. Just to provide some context, the state of Wisconsin had $51 million that we got from the CARES Act that was then allocated through a COVID bill that the legislature passed in April. And that was to provide stabilization grants to childcare providers, among other things. And that $51 million was spent in 2 months. So while $30 million seems like a lot of money, it isn't in the grand scheme of things. And as Ruth had mentioned, with so many providers struggling to make it with a decreased capacity, some of these grants I think will be essential to keeping providers open, especially as things fluctuate over the next weeks, months with COVID. Again, within our package of budget requests, as Ruth had mentioned, we are looking to increase Wisconsin Shares eligibility from 185% FPL, federal poverty level, to 200 for infants and toddlers. We are also looking to contract for 50 infant toddler classrooms for priority populations, and also looking to increase Wisconsin shares to 75% of market for infants and toddlers.
And I just want to just jump in for a second to say what we're giving you here is sort of talking about this in a broad context. But please rest assured that we have done significant work in putting price tags around what each of these asks actually looks for. So we're coming in with an actual dollar amount around what will it cost to contract for 50 infant toddler classrooms? What will it cost to raise shares eligibility to 200% of poverty? And we've presented all of that with backup documentation to Department of Children and Families.
So as a part of this effort, we could use you and your organization, or if you're a provider, the parents and teachers in your center or your program, to help advocate, to move these initiatives along, whether it's at the state, local, or federal level. And so there are different advocacy opportunities. We have it packaged here as ally, advocate, and champion. So let's see, with an ally, this would be sending recommendations to your membership or network saying, we really support, a $30 million stabilization grant for programs. Sharing information via social media or newsletters. Again, through either your organization, your program, talking to parents, other teachers, etc. Also, if you're affiliated with an organization or association, request to have someone from the Infant Toddler Policy Project come and present and talk more about our various budget requests, other bills that we're going to push next legislative session, etc., to expand the knowledge of what we have planned for the next 2.5 years, to add your voice and to gain additional advocates. So at the advocate level would be all the stuff we already had talked about, as well as saying that your organization or association would put at least one of our policy goals on your published policy platforms. So again, if you have your legislative initiative that you're advocating for or asking for next legislative session, incorporating at least one of our policy goals on there, as well as signing on to letters to legislators or other government officials advocating for at least one of the policy goals. At the champion level, again, all of the above, as well as actively advocating for at least one of the policy goals. So doing legislative visits, stopping by the governor's office or at the Department of Children and Families, and really sharing your stories, adding your voice to the mix. I will say that does make a difference, especially contacting your legislator. Legislators are often very receptive to the needs of their district. And the more contacts they get, that often will persuade them to move in a certain direction or vote for a specific proposal or bill if there is enough momentum from their district. So advocacy needs, like I had mentioned, federal, state, and local. So at the federal level, the Senate and the House both had varying COVID proposals that included funding for childcare, though right now it is stalled and it is unclear what is going to happen at the federal level in regards to additional COVID funding and funding for the industry. But with that said, we encourage you to contact your federal representative. So Jen just had included the links in there to find who your House member is and your US Senator, just to advocate for additional funding for the industry and tell your story and talk about what is going on and what you are seeing, again, adding your voice to the dialogue. At the state level, so like I said, the next legislative session doesn't start until January, but that does not mean that there is nothing to be done. So right now is campaign time until November for the Assembly and Senate. So one could engage with local candidates and talk to them about what is going on in the industry and what you've been seeing with families, with other organizations, and how they've been impacted by the lack of affordability, accessibility of childcare. You could also contact Governor Evers' office, again, telling your story and talking about what you've been experiencing, and then again, advocating for, like, again, the $30 million stabilization funding to be included in the next budget bill that he'll be releasing in February. And then once there is Inauguration Day, or even after the election, contacting the newly elected officials and let them know what you care about and what you would like to see them do when January starts and the next legislative session starts. As well, there's still some remaining CARES Act money that Governor Evers has that he can allocate to different sectors, and I would encourage you to reach out to his office and again share your story about what you've seen going on around the state or in your community in regards to the child care industry, and ask for him to allocate some of that remaining money for child care funding for the industry. Also wanted to, and so on the link there, and I know Jen put it in the chat box, if you want to find out who your state elected officials are, there's the website legis.state.wi.us. You can find out who your representative is and your state senator, and it provides contact information as well as even the staff's contact information. And I just have to say there are a lot of times where people will reach out and not send it to just say the senator or state rep, but the staff too. And that does make a difference. And sometimes the elected officials will check their email and not share it with the staff. And it's helpful to have everyone on the same page as to what some of the needs are and interests are in the district. Also, WECA has Forward for Kids, and we provide advocacy updates. So I think Jen was putting that link in the chat box as well. And so that's a great way to stay informed as the fall moves forward and we approach the next legislative session. And then locally, again, like I had mentioned, with K-12 schools going virtual or hybrid, or honestly the ones that are even going in person, as we all know, it's such a volatile time, and some of them may start in person, but that very well could change within a matter of days or weeks or months. So having that conversation locally as to the services you provide and having that communication with your K-12 school district, as well as within your local municipality or at the county level. We've seen examples of that all over the state, from, like I have an example there, the Richland and Jackson counties both have child care task force that are made up of child care providers, employers, chambers of commerce, local elected officials, et cetera, just to have that dialogue and that conversation, so that then as things change, you have a united effort to try to keep things moving forward best they can and have that collaboration.
And I just want to jump in quickly to assure those of you who are in the work of providing care for our youngest kids that since COVID has hit, and even before COVID, but certainly since COVID, we have had many opportunities at WECA to meet with either chambers or with workforce development, the Wisconsin Economic Development Corporation. Lots of opportunities to get in front of business leaders. And I just want to sort of give you every assurance that when we are talking to those leaders, we are saying you need to reach out to your early childhood programs in your community, and you need to help facilitate conversations that include your early childhood programs along with your school districts to really talk about the best local ways to respond to what the emerging needs are in your communities.
So moving ahead, as this campaign continues, we encourage you to stay informed and stay in the loop as we continue outreach and gather feedback from what's going on around the state from providers, teachers, and other community members. We encourage you to become a WECA member. We send out regular updates as to what is going on, whether it's legislatively, what WECA is working on in the field, etc. We also have, Jen, I think, is also linking to our website. It's wisconsinearlychildhood.org. We also have a page dedicated to the Infant Toddler Policy Project, and we'll be updating that regularly as we have new information on our policy project and the various deliverables and our various advocacy efforts. Questions? So thanks so much for listening to Ruth and I. Now we'd love to hear from you, hear what questions you may have. Please enter them in the chat box, and Jen will kind of feed them to us and we'll address them the best we can. Also, just a reminder, again, for registry credit, if you haven't done so already, please make sure to put your name and your registry number in the chat box so you can get credit for this. And then our contact information here at the end. If you have any additional questions, want to stay in the loop, etc., please feel free to reach out.
So I think, Chanel, perhaps you've been monitoring if there have been any questions, if you want to share those with us before we wrap up.
So there haven't been any questions in the chat box yet.
Okay. We'll just give you all another minute or two. I just want to sort of reiterate some of the things Kimber talked about. Whether it is paying attention to what we're going to be advancing over the course of the next 3 years around the Infant Toddler Policy Project, or whether it is limiting your engagement around what we're looking at for the current budget priorities, We really encourage all of you to stay deeply engaged in this work. There are many different national organizations you can connect with, including First 5 Years Fund, the National Women's Law Center, Child Care Aware of America, NAEYC, all of those organizations, the Save the Children Action Network, all of those organizations have information on federal actions that you can take right now. Please stay in touch with WECA because we will be pushing out lots of opportunities for advocacy in the coming months heading into the state budget cycle. Any questions, Chanel, or?
No questions. Everyone is just saying thanks for the good information and all the work that WECA does.
Great. So I'm going to stay live for just a couple more minutes to ensure that everybody has an opportunity to get their name and registry information submitted.
We do have a comment from Renee. She just said that she's excited to participate with WECA on advocacy issues, that all of the talking points are exceptional, and we need to join our voices for increased outcomes, and have a number of early learning leaders who want a home to advocate in.
Thank you, Renee.
Awesome.
We look forward to working with you.
Others are just saying, again, thanks for the information. Looking forward to learning how to begin to advocate.
All right. So we'll stay live so people can continue to add things in that box, but thank you all for participating, and we look forward to ongoing conversations with you in the coming weeks and months.